आफ्टरनून एवरीवन। आज जो हम लोग टॉपिक करेंगे वो है सेकेंडरी एमिनोरिया। ओके, इट्स बहुत इंपॉर्टेंट टॉपिक है, नॉट ओनली फॉर योर एंट्रेंस एग्जामिनेशंस। अगर आप AIPGT की तैयारी कर रही हो और एनी PG एंट्रेंस की तैयारी कर रही हो, इट इज ऑल्सो वेरी गुड टॉपिक फॉर योर BHMS, BAMS और MBBS एग्जामिनेशन। ठीक है, सो हम लोग MCQ वाइज इसको पढ़ेंगे। सिर्फ एक ही MCQ आज मैं शेयर करने वाली हूँ। ठीक है, सो लेट्स सी व्हाट इज द क्वेश्चन. Now, a married woman with regular cycles stop menstruating for 5 months. What is the first step of evaluation? आप क्लिनिक में बैठे हो और एक फीमेल पेशेंट आती है एंड शी स्टार्टेड कंप्लेनिंग दैट मुझे पीरियड से 5-6 महीने से नहीं आ रहे हैं. शी इज मैरिड, तो आपके दिमाग में सबसे पहला जो सोच क्या आएगा? It's a pregnancy one, right? So here the answer will be the pregnancy test. Okay, so options are TSH, is it prolactin, is it pregnancy test, or the USG pelvis? Yes, it is a pregnancy test. याद रहे, if even in the question if they can ask what is the most common cause of secondary amenorrhea, if ये अगर क्वेश्चन आए then also your answer will be the pregnancy. ठीक है. Now let's move. What do you mean by the secondary amenorrhea? So a woman is previously menstruating and now she develop a loss of period, okay, or no menses. Why? For 3 consecutive months, okay, when the cycles are regular, so there is a 3 consecutive month no periods, or there are periods in irregular way. 2 महीने में 2 मंथ नहीं हुआ, 1 मंथ में हुआ बट बहुत स्कैंटी हुआ. So these are also called as a secondary amenorrhea. So any woman with secondary amenorrhea is pregnant until they proved otherwise. Okay, now let's move to the another question, amenorrhea and the galactorrhea. What is this? Is it PCOS, hyperprolactinemia, hypothyroidism, or the ovarian failure? Okay, whenever there is a galactorrhea, that means increase of the prolactin level. So whenever there is an increase of prolactin level, that means increased secretion of the milk. Okay, so this increased secretion of the milk is termed as a galactorrhea. Okay, so here what is the options are PCOS, hyperprolactinemia, hypothyroidism, or the ovarian failure. So increase of prolactin means hyperprolactinemia. Okay, so the answer will be hyperprolactinemia. अभी दिमाग में क्वेश्चन आएगा क्यों हाइपरप्रोलैक्टेमिया में एमिनोरिया आता है. So let's move to the now detail of this question. Okay. Now what happened? So let me erase this. Yeah, now what happened here? Whenever there is an increase of the prolactin level in the body, what they do, they usually decrease the FSH and the LH secretion. Okay, FSH and the LH. So this prolactin, it inhibit the first, they inhibit the gonadotropin releasing hormone, GnRH hormone, and we know that GnRH released both the LH and the FSH in a pulsatile manner. If there is an increase of the prolactin level in the body, it causes decrease of the LH and the FSH level, and the patient or the person suffering from the anovulation. Okay, so no ovulation. If there is a no ovulation, we know that the uterus. So suppose this is a uterus and its endometrium lining is made up from the estrogen. Okay, and progesterone help to make the endometrium secretory. So if there is a no estrogen, so person is suffering from the anovulation, so no endometrium layer formed, and as a result there will be a no bleeding. Okay, so endometrium does not develop properly, which resulting into the amenorrhea. So this is one of the reason why we have amenorrhea in hyperprolactinemia. Now the second question, okay, then why we have amenorrhea in the hypothyroidism? Okay, so in hypothyroidism, we know that there is an increase of the TSH level in the body. decrease of the T3, T4. Whenever there is a decrease in T3, T4, it has given negative feedback to release the thyrotropic releasing hormone, that is TSH hormone, which stimulate which stimulate the release of the prolactin. Okay, and now we know that how the prolactin decreases the level of the LH and the FSH, and how we get the amenorrhea. Okay, so that is my hypothyroidism. The person who is suffering from the hypothyroidism, they most probably and most commonly they suffer from the secondary amenorrhea. Now PCOS. What is PCOS? There is a secondary amenorrhea plus obesity plus acne and the hirsutism. One thing you should always notice that I have seen in my clinical practice, a person who is PCOS, they suffer from this hypothyroidism also, because they are interrelated. Okay. Now in PCOS, what happened actually? Okay. So this is very important. We know that the normal LH and the FSH level in the body is 1:1. But in here, in PCOS, there is an LH, and the ratio of the LH and the FSH level increases. Okay, so LH is more increases than that of the FSH. So this is very important. Either the ratio will be 2:1 or the 3:1. So LH will be always in the higher side. The normal is about 1:1. बहुत important questions है. What is the normal LH and FSH value? Okay, now what happened in the PSH? There is an increase in the LH level in the body and decrease of the FSH. Okay, now why? Now we know that the gonadotropin releasing hormone, they release two type of the hormone. One is luteinizing hormone and other is your follicle stimulating hormone. Now this luteinizing hormone and the follicle stimulating hormone, the GnRH, releasing this hormone in a pulsatile manner. Okay, so GnRH has the two type of the pulse. One is your fast pulse and the other is your slow pulse. In PCOS, what happened? There is an increased amount of the fast pulse, and the fast pulse help in the release of the LH, and slow pulse help in the release of the follicle stimulating hormone in a balanced way. But in PCOS, what happened? There is too much increase in the pulsatile, like pulse manner, okay, releasing of the pulsatile manner. In PCOS, the pulsatile manner highly increases. That is why we get there is an increase of the LH hormone than that of the FSH hormone. So what happened? LH increases. Okay, if I have another, no. So if there is an LH increases and the FSH is, that is follicle stimulating hormone, बहुत decrease हो जाता है, right? So if there is a follicle stimulating hormone decreases, that means a follicular maturation नहीं होता. So follicles develop नहीं हो पाते. So follicular maturations are incomplete. And the follicles, they arrested in their immature phase. Okay, so they are arrested. So when the follicles are arrested, so there will be no ovulation. Okay, that means no ovulation, and the periods are the anovulation of the chronic and ovulatory cycles. So that is why we have got the amenorrhea in the PCOS. Okay, the polycystic ovarian syndrome में सबसे मोस्ट कॉमन जो होता है, that means about your secondary amenorrhea. Okay. Now, in PCOS also, what they do, they usually stimulate the ovarian theca cell. Okay. So if I'm writing it here, so I'm just, yeah. So I'm writing it here. What happened in the other, why we have hirsutism, why we have acne. Okay. Now in PCOS, we know that there is an LH increases and the FSH is either normal or it is decreases. Now this increased in the luteinizing hormone, they overstimulate the theca cell which surrounded the ovary. Now this theca cell produced androgen. Okay, this theca cell it produced androgen, and this androgen, what they do, they suppresses the ovulation. They decrease or they suppresses the ovulation. Okay. And also this androgen, if there is an increase of androgen, there's increase of testosterone, so the person will suffering from hirsutism. Okay. So there will be the hirsutism and also there is an acne. So hirsutism and the acne. Ovulation in androgen, there is a decrease in the ovulation. It suppresses the ovulation and also there is an follicular atrasia. Okay. And also if there is an increase in the androgen level in the body, there is an estrogen imbalance. Okay. So in estrogen imbalance, what happened? There are the estrogen ज़्यादा हो जाता है. So estrogen increases, and the most common what we will see, there is a deposition of the peripheral fat or the fat especially in the lower part of the body. Okay, so peripheral fat. So this is the most important thing why we have a secondary amenorrhea in the PCOS, in the hypothyroidism and also hyperprolactinemia, and ovarian failure is the same thing. When there is an follicular atrasia, okay, then the ovary become there is a no ovulation takes place in the ovary. Okay, so that is called as an ovarian failure. Okay, now the fourth, the very important cause, if the uterine cause. Now, if every cause is okay, suppose his TSH level is normal, prolactin level is normal, all the hormones levels are normal, then there must be some uterine causes, which is usually occur after the medical termination of the pregnancy or DNC. Okay, the most common complication is the Asherman's syndrome. Okay, now suppose a patient comes to you for the secondary amenorrhea, the first test common will be the we have to go the pregnancy test. If there is a negative, if the test comes negative, then we have to do the thyroid stimulating hormone and plus the prolactin hormone to know if there is an increase of TSH, that means hypothyroidism, increase in prolactin level, that means it is hyperprolactinemia. Okay, now these are also normal. Now we have to go with the progesterone challenge test. So what is this test? You have to give progesterone to your patient. आपको progesterone दिया जाएगा, ठीक है, progesterone first देंगे, फिर बाद में कुछ दिनों तक वेट करेंगे और देखेंगे ब्लीडिंग स्टार्ट होता है कि नहीं है. If the bleeding started, that means progesterone challenge test is positive. So अगर progesterone challenge test में bleeding is positive, the bleeding started, that means there is a sufficient amount of the estrogen is there. So that is why the uterus, there is an endometrium lining has prepared. Okay, and also endometrium भी बना हुआ है. Okay, the endometrium lining is also prepared. Okay, the outflow tract, okay, the outflow tract is also okay. Okay, it's also normal. There is no obstruction in the outflow tract. Okay, so what is the most common if the withdrawal bleeding is present? The most common cause will be the anovulation. Okay, this is the most common cause. Now suppose आपने इंजेक्शन दिया प्रोजेस्टेरॉन की और कोई ब्लीडिंग नहीं हुई, ब्लीडिंग नहीं हुई, दैट मीन्स आइदर, इसका मतलब क्या है, द ईस्ट्रोजन ही कम है. सो दैट इज वाई द यूटेरस ने एंडोमेट्रियम का तैयार ही नहीं किया है. ओके, सो दैट इज ईस्ट्रोजन इज लेस है. और there is some damage in the uterus lining. So there is some endometrium damage. Or everything is okay, so there isn't some problem in the outflow tract. Okay, so in this way we can diagnose, we can think it out. So what is the most common cause in this way? Suppose increase of TSH हुआ तो hypothyroidism, prolactin हुआ तो hyperprolactinemia. ठीक है, LH and FSH का रेशियो देखेंगे. ओके, सो दैट इज एन ओवल्यूशन. और एक सबसे जो मोस्ट कॉमन दैट इज प्रोजेस्टेरॉन चैलेंज टेस्ट करके देख लिया कि अगर विथड्रॉल ब्लीडिंग होते हैं, दैट मीन्स एवरीथिंग इज नॉर्मल, ईस्ट्रोजन भी सही सही है, यूटेरस की लाइनिंग भी सही तैयार हो रही है, आउटफ्लो ट्रैक भी सही है, So there is a problem with some your progesterone. Okay, so that is secondary endometrium वो बना नहीं पा रहा है, and that is why suffering from the end ovulation. Okay. So these are some of the important causes and how and why the secondary amenorrhea occurs in this type of this problems. Okay. So thank you everyone. Let me know how is the class, and if you want anything, just type in the chat box. Like anything regarding gynecology or anything, okay, any chapters or anything, do if you have any doubt.